Hey guys, Tony Maritato here, physical therapist. So first, the disclaimer. This is not a video intended as medical advice. Do not do the stuff that I'm showing in this video. This video is purely for education. I've received this question enough times that I thought, you know what, let me show you what's going through the mind of a therapist when they're assessing a shoulder injury, especially an acute shoulder injury, an injury that happened within the last 12 to 48 hours. So this is just my explanation of what I'm thinking. It's not a recommendation on what you should do. Go see a doctor, go see a surgeon, go see a physical therapist, get a complete medical history, medical exam, orthopedic scan. Now let me talk to you about shoulder injuries, especially recent shoulder injuries. I received an email this morning. A gentleman playing with his son fell, hit his elbow, hit his shoulder. Now his shoulder is so painful, he feels like he can't move it, and he's concerned and wants to know what to do. Very common situation. The first thing that I'm looking for when I speak to a person like this is what was the mechanism of injury? And then what was the immediate response? What did it feel like? Where was the pain? Could you qualify the pain as sharp, stabbing, aching, throbbing, dull? Do you feel that the pain was in the muscle, the tendon, the ligament, the joint itself? Were you able to move the arm? If you could move the arm overhead, behind your body, behind your head, was it painful? Was there clicking and popping? I'm looking for these kinds of descriptive words to help me figure out where I think the pathology might be. I'm trying to rule out, is it a fracture? Is it a joint separation? The most common, when you fall on your shoulder, the most common joint separation happens where the clavicle comes into the shoulder blade, the AC joint, or the humerus, the arm bone actually dislocates down. Certainly there is a possibility of a collarbone fracture, a humeral fracture. Certainly there could be a neck injury. So these are all the things that we're trying to consider. That's why this is not meant as medical advice. That being said, once we rule out fracture and we can be sure with imaging that there are no bony fractures, and we can assess visually and with imaging that the collarbone isn't dislocated or fractured, the AC joint isn't separated, the humerus is not dislocated. Once we rule out all those red flags, then we can say, okay, now what are you feeling? What is your strength pattern like? Is it possible that you ruptured a muscle or tendon? Is it possible that you sprained or ruptured a ligament? And that's where we start going through some muscle testing, which I'm not going to show you here in the video, but that's typically done in the clinic with the therapist. As we go forward, the first 12 to 24 to 36 hours, the expected course of the symptoms for a standard sprain or strain is going to be immediately it's muscle guarding, tension, you get tight, you're concerned, you're not sure what's happening. As you get past that immediate response, the adrenaline kind of calms down, you start to feel this throbbing, aching, soreness. Certainly you can move in all of your available ranges of motion, but it will be painful, sore and stiff. What's happening is as the tissue that was damaged starts to heal, it elicits what we would call an inflammatory response. I would call it an immune response. Your immune system is sending carrier cells to the area to help clean out the debris, to bring nutrients back in, to start the healing process. The swelling that occurs within the joint and the surrounding tissue is a combination of you're not moving the arm as much because it hurts, so you don't get the normal muscle activity to get that fluid out of there. Also the increase in the saltiness, the acidity of the area with the new chemicals that are coming in to clean out the debris. That's going to contribute to more fluid in the area. It's hot, it's swollen, it's painful. Those are signs and markers of inflammation. So typically, once you've been cleared and you understand that it's safe to move, the most appropriate action is early, gentle movement. Now, typically, we would see a patient and we would advise them to start doing a couple things. We want these things to be pain-free, but probably not gonna be discomfort-free. And there's a difference. Pain is an alarm signal that could be leading to further injury. Discomfort is, look, I just fell, it hurts, it's swollen, it's uncomfortable. I almost said pain. That's the difference. So only you know the difference between pain and discomfort. But typically what we do is we start, I'm gonna back up so you guys can see me. We start with some basic pendulums. So let's say it was my right shoulder. I might lean against a wall. I might just bend over in space. I allow my arm to relax. That's probably the first and most important thing, is just getting the arm to relax. If your arm weighs 6 pounds, 8 pounds, 12 pounds, that's 12 pounds of traction pulling down, creating a little bit of space in the shoulder. Our normal response to pain is to tighten, to recoil. If I poke you, you tighten and you move away. So by relaxing, we allow the tension in that muscle to dissipate. We allow the circulatory system to come through that muscle and just kind of pump out all the junk. So a pendulum, basic pendulum, I relax, my arm hangs heavy, I move my body, and my arm just dangles. As a clinician, the way I know my patient is doing it correctly is if their hand, wrist, let's say, and torso move together, they're not relaxed. Everything is tense. What should happen is there should be a little bit of lag. You should see my hips move forward first, and then my hand trails. That is relaxation. And I can go side to side, I can go front to back, I can do little circles clockwise, circles counterclockwise. It really makes no difference. The idea is you want to relax the initial guarding response to allow the circulatory system to come through the tissue. That's super common. Almost every clinic you go to is going to issue a pendulum Codman type exercise. One of my favorites that we don't really discuss very much is a version of, so I get into that kind of relaxed pendulum position, and then if you can see my hand, what I'm doing is I'm rotating my hand palm away from me and then back to me. Palm away and back. So this internally rotated position is a normal resting posture. What you're doing is you're rotating the hand away from you and then relax. So basically I'm taking this bone right here within the shoulder, within the joint capsule, I'm rotating it out and then relaxing it back in. It's an extremely safe exercise and movement because it's down. I'm not in this overhead flex position. Even with an acute injury, most of my clients will tolerate this kind of rotation. In the gym or in the clinic, you probably have seen people do an external rotation with the elbow bent. Think of it similar, but I'm doing it with the elbow straight to just roll that humerus, that upper arm bone, within the joint itself. I usually have my patients do 10 to 20, again, depending on sensitivity. We'll do 10 to 20 pendulums, 10 to 20 rotations, and then typically what I'll do is I'll have them put the affected hand so their palm is on their belly button, the other hand is supporting at the wrist, and then I'll just have them do a basic shoulder roll. And so if I turn sideways, you can see that it's the entire shoulder complex that's moving. I typically go up, back, and down, because what happens when the shoulder is injured with shoulder, base of the neck, SC joint, any of the structures in here, the patient comes in looking like this because they're so guarded and protected and scared. So the first thing I do is I just get them to relax. I look at the space between the earlobe and the tip of the shoulder, and it should be symmetrical from the non-injured side to the injured side. And once I get them relaxing, if they still just, it's so scary, it's too uncomfortable, I don't know what to do, I have them actually tense higher, shrug the shoulders higher, and then slowly have them depress or retract or press down. You know, because a lot of times your brain is just on full alert and you're terrified, you don't know what to do. So if you tighten more, then you have room to come down. So those are my 3 go-tos. I'm not telling you to do it, but I'm explaining what the clinician is thinking after they've ruled out the red flags and they're looking at an acute injury, 24, 48, 72 hours, to reduce pain, reduce swelling, improve the healing process and just reduce that kind of reflexive muscle guarding that most clients don't even realize they're doing. If you do get put into a sling, same cueing. So I just saw a gentleman 2 days ago, fractured collarbone, completely displaced, came in with a sling. His shoulder was like this. We loosened up the sling strap so that we can get that shoulder down, resting symmetrical, horizontally across their body. And we talked about just letting that shoulder blade sit back where it's supposed to be on the chest, because the tendency is to round and tighten and be fearful. You know, even just your breathing. I guarantee if you're in pain right now, your breathing is restricted and you're not taking that deep breath because you're so nervous that it's gonna hurt and cause more pain. Just relax. Take a couple nice deep breaths in through the nose, out through the mouth, and feel and allow that chest to expand so that I breathe in through the nose, my chest gets big, my shoulder naturally drops back into a normal resting posture. And then I exhale and I relax. Yes, it's gonna be uncomfortable, but it should not be painful. If you're experiencing any of the red flags or any of the concerns that I discussed in this video, absolutely, you need to have a medical assessment done. Injuries can be tricky. There can be fractures that don't show up immediately. There can be other complications. So just have this information for educational purposes only. Go out, talk to a professional, see what they think is going on with your shoulder. And by all means, feel free to post comments below, ask questions. I love the interaction. Thanks so much for watching.